it's Mama Beth. I'm back in the kitchen, and I thought that today we would continue with my series on different personality disorders, and the one I want to touch on now today is borderline personality disorder. Now you hear people talk about BPD, and that's what we call it short term, because borderline personality disorder is a mouthful. But I have to recount the first patient, one of the first patients that I ever worked with who said that they had been diagnosed with BPD. And she started singing Borderline by Madonna. And I was like, I had never even thought of that throughout school, throughout, you know, all my classes when, you know, you study different things. That song had never come into my mind, but she identified with it and was singing it and very happy about it. And I said, I don't think that's exactly what Madonna was talking about. And she said, yeah, it is. And I said, well, how do you relate to it? And she said, because I feel like I'm going to lose my mind. And that made me sit back for a minute. Because if someone identifies with a song or a saying, and that strongly, who am I to tell them they're wrong? Okay? Borderline personality disorder is not something to be taken lightly. It's called borderline personality disorder because it's on the border between neurosis and psychosis. Okay, what are they? A neurosis is a feeling of worry. It's a milder mental illness. It isn't quite as debilitating a neurosis is. You might, you see the woman who worries too much. She frets over her house, her kitchen, and she's constantly internalizing. She's not sure of things, or he. It could be female or male, but when we see someone that we call neurotic, they seem to feel everything intensely, and they take a lot of blame upon themselves, and oftentimes worry when they haven't done anything wrong. They don't understand that they're not responsible for everything going on in their lives or in other people's lives, but they worry a lot. But that's, having neuroses, and there are different kinds, is not quite as, well, it's nowhere near as bad as having psychosis. Psychosis, it's when you lose contact often with reality. You don't know the proper emotions to have. You don't have a guideline. You can, people with psychoses often act out in anger or fury when it's not really warranted, and it wouldn't be within the normal scope of people's reactions. Okay, they don't understand that, they don't get why people behave the way they do. They don't have a normal range to gauge things with, and having a psychosis is very difficult to treat. That's why borderline personality disorder is between neuroses and psychoses. That's why it's borderline. It's very difficult to manage, and it wasn't until the late 80s, 90s we started seeing this in patients, and they didn't know how to identify it. They didn't know what to call it. They saw both sides of, both ends of the spectrum there, but, at times the person would be delusional, have hallucinations, but not to the point that they were, could be identified as schizophrenic or schizoaffective. But then they also were so worried and unsure of themselves, it was the neurosis. So that's why borderline came up, and that's why dialectical behavioral therapy, DBT, was developed, and it was pretty much just to treat borderline patients. Now, if you know someone who has borderline personality disorder and they're getting the proper treatment, they're going to be seeing a psychiatrist, okay, to make sure that in case they have dual diagnosis, that they're medicated. But medication is not the first thing you do for a borderline patient. Okay, that's not until later down the road, and if they need it. The first thing we do is we do a series of tests, and it's by a person licensed to give those. You've heard me talk about different personality disorder tests. The Minnesota Multiphasic Personality test that's the one that we use, and that's the one that I recommend. It's expensive, but it's worth it. And so the first thing we do is put someone with borderline personality disorder, put them in talk therapy, one-on-one with a therapist. The second thing, the therapist will not only use talk therapy, but dialectical behavioral therapy. And I'm going to go into what that is. And then they will be asked to join group. So other people with borderline personality disorder as well can talk about what's happened in their lives, how they've handled it, what they did that they wish they hadn't, but we learn from one another. And people with BPD are not doomed to be, you know, what we would call out of hand or need inpatient therapy for the rest of their lives. You can learn to control things. Okay, they have some measure of control, and with DBT, group therapy, one-on-one therapy, talk therapy, we can work on their symptoms and their behaviors, and give them relief so they can live a normal life. Now I'm going to go into what dialectical behavioral therapy is. Okay, what's DBT? Dialectical behavioral therapy. What is it? Okay, let's do a standard. I got my notes. It's a focused concept of mindfulness. Now, what does that mean? It means teaching you skills. When you use dialectical behavioral therapy, we teach the skills to control intense emotions, reduce the self-destructive behavior, manage distress, and improve relationships. It seeks a balance between accepting and changing behaviors. There's some behaviors that you have as a person, even if you have BPD, that are okay, that are within the normal range. But dialectical behavioral therapy teaches you which ones are okay. It helps you think ahead and plan. Am I responding right to the stimulus? Like if someone goes by you and bumps into you and doesn't say excuse me on the street, do you fly off the handle or do you just keep moving on and let it brush off? These are the things that DBT teaches: how to respond, how to react, how to behave, basically with mindful control. You are in control of yourself. And when you have borderline personality disorder, oftentimes you don't know how to control yourself. You don't understand where the boundaries are. I say boundaries a lot, but I'm talking about boundaries in behavior. Okay, should you be screaming in anger, or should you be calm, or somewhere in between? Okay, it's a proactive problem-solving approach, and like I said, it was designed specifically for borderline patients. The treatment has individual therapy sessions. Like I said, you'll be in group counseling. You will sometimes do phone coaching. There are apps for an iPhone. I know the ones that I've seen were for iPhones. I don't know if they're for Androids as well, but they can help you. And I recommend that any patients with BPD, they use all these resources. Do all of it. Because if you're not in control of yourself, then you're out of control. All right? And you can do damage to yourself and to people around you in your relationships. MBT is mentalization-based therapy. We also use that as well. It helps you understand and identify what others, and understand what others might be thinking. You want to say, okay, they said this, what do they really mean? What are they thinking about? And am I being paranoid that they're thinking mean things about me or bad things? Or could it just be that they threw that off? And how do I need to react to that? It helps you understand how others that don't have borderline personality disorder are thinking and what their behaviors mean. There's transference-focused therapy. That's designed to help patients understand their emotions and interpersonal problems through the relationship between the patient and the therapist. The patients will tell the therapist about something that happened, and then basically I go over and with them, okay, this happened, and this happened, and you reacted how? And they say, and I'm like, and I say, how should you have reacted? Do you wish you'd done something differently? Did you need to do that? Tell me your reasoning behind it. And then usually the best part of it, the most rewarding part for me, is when they sit back and go, I didn't need to do that. I could have done this. And I'm like, okay, well then the next time you do. It's seeing goals for behaviors, and it's very rewarding for both the patient and for the therapist, like me, to see someone starting to understand how the reactions fit the actions before. if you know what I'm talking about. And then, of course, whether you're going through individual treatment or you're doing group as well, using the apps, you need to have good psychiatric care. You need to be seeing a psychiatrist every 3 months. You need to be seeing your therapist as often as you need. Usually I see people either once a week or twice a month, some once a month. It just depends. But you need to have good care. You need to have good psychiatric care. And if you don't like your psychiatrist and if you don't like your therapist, go find another one. There are plenty of us out there. And some are better than others. You know, I hear horror stories all the time, and then, you know, they say, I'm so glad I found you. Which, I'm not trying to brag on myself, but there are probably patients of mine who are like, I hated that woman. I'm going to see somebody else. But the most important thing with this issue or any other issue that you might have, make sure that you're completely comfortable with your psychologist, you know, the whole psych management team. Make sure that you feel like you're being paid attention to, that you're getting the help you need, and that they're taking what you say seriously and they understand your problem. Okay, and then, of course, borderline personality disorder is not just something that you can pop a pill. You can't just go to a therapy session and come back and go, okay, I'm good for now. This is something that you have to work on daily. There are daily activities for self-care. And if someone with BPD doesn't do these, the therapy that they're getting, any medications they may be on for dual diagnoses, you know, comorbidity, it's not going to work if they don't work it. It's kind of like, you know, AA, it works when you work it. It's the same with this. You know, you have to manage your sleep. You have to make sure you get a good night's sleep. You have to make sure that you eat properly. You're exercising properly. You're thinking about the things that you've learned in therapy daily, that you're applying them to situations so you don't fly off the handle. You don't get out of control. You don't, you know, mess things up because you're not using the tools that we're giving you. All therapy is, you know, care and tools. And these tools that you take home, you have to use. Okay? Good care reduces common symptoms of BPD, such as mood changes, impulsive behavior, and irritability. You have to identify your stressors if you have BPD. You have to identify what is stressing you out, what is hurting you, what your triggers are, and there's that word again, and avoid them, okay? So we're going to go a little bit into exactly what the symptoms of borderline personality disorder are. I probably should have done this at the first, but I'll do it in the middle this time. But let's go through what the symptoms are and see if you recognize these in maybe a friend or a family member or a spouse that's been diagnosed. Then you'll understand that these symptoms are not because they're, you know, doing it on purpose. This is part of their mental illness. And once you understand that, you can understand that it's not your fault. It's not their fault, but it's something that you need to work on and they need to work on. Be right back. Okay. What exactly are the signs and symptoms of borderline personality disorder? Let's get down to brass tacks. It's a mental illness. It's marked by ongoing patterns of varying moods, self-image, and behavior. Okay? These symptoms often result in impulsive actions and problems in relationships. People with borderline personality disorder may experience intense episodes of anger, depression, and anxiety that can last from a few hours to a few days. People with BPD have mood swings that are severe. They can go from loving you and thinking that you're the greatest person in the world, you're their best friend or best person they've ever been around, and they just idolize you, to, you know, within a few minutes they hate you and you might as well be called the devil. And they want to do nothing but hurt you and destroy you. Those mood swings are severe. People with BPD tend to view things in extremes. It's all good or all bad. Their opinions of people change. Like I said, you know, you can be a wonderful person and then, you know, with very little stimuli, they see you as somebody that is their enemy and they will act out on it. Other symptoms, efforts to avoid real or imagined abandonment. They have a real fear of abandonment. And sometimes they're not being abandoned, but they feel like they're going to be. So they react to that. They will also rapidly initiate physical contact, like sexual relationships. Emotional relationships. It's just real fast bonding because they always have a fear that people are going to leave, so they have to attach themselves really quick. They might hop into bed with you within a few minutes of knowing you. Perhaps they decide you're their best friend within a few text messages, you know, or they become obsessed with you really quickly. But, and you're going, whoa, wait a minute, slow down, because that's not how we normally bond and form our relationships. They have a pattern of intense and unstable relationships with family, friends, and loved ones, often swinging from extreme closeness and love in their idealization of that person to extreme dislike and anger. And that's the devaluation. They have a distorted or unstable self-image or sense of self. They don't really see who they are. They don't understand themselves as well. Usually by the time that we reach, I'd say 16 to 18, we have a pretty good idea of who we are. You know, we see ourselves in somewhat in categories. You know, in school we might enjoy the feeling of being, say, the nerd, the smart kid, the musician. You know, we are whatever, the basketball jock. You know, we find ways to identify who we are, and it's in accordance with how people treat us. And you know, and maybe we don't have everything locked down by that age, but we have a good sense of who we are as a person and what we like and what we don't like, and behaviors in others that we like and don't like, and behaviors in ourselves that we like and don't like, but we understand who we are for the most part, you know, and that continues to develop through our lives. I don't think we ever quit changing and figuring out who we are as people, but we generally have a pretty good idea of our basic mores and ethics and codes of conduct and behavior that we follow along, and that's pretty much developed by the time you're 16 to 18. You know how you're going to act. But people with borderline personality disorder never get that parameter of understanding who they are. One day they may think, oh, I'm going to be, you know, famous, or oh, I'm going to be a musician, or oh no, I'm going to be the nerd who knows everything. And I say nerd in a good way. Nerd and geek are great for me because they're the smart people who always make good money. But you know, or maybe the socialite. But these different categories that we put ourselves into, someone with borderline doesn't understand which one they fit into. They don't know exactly what the box of appropriate behavior is. They switch back and forth, and oftentimes you'll see them switch almost personas to fit the situation they're in. If they're at a party, they may decide to, you know, if you take someone to a party and you think, and they've got borderline personality disorder, and you think, oh, they're a nice, quiet person, and they'll get along with everybody that's here, and then they get there and it's quiet, and all of a sudden they start acting out, dancing on a table and acting inappropriately. Oftentimes it's because they're nervous and they don't understand how to behave in that environment, what's expected of them. And it's very hard. It's very difficult, and that's why it's so difficult to treat. But, you know, and that's an extreme example, but say they're online and they're in a discussion with someone that the person isn't agreeing with them, you know, 100%. Maybe they're having, you know, a little bit of a debate. Then all of a sudden, you know, they go batshit crazy for no reason when it was just a discussion. That is a symptom of borderline personality disorder. They don't understand what the proper behavior is in the situation. Put my glasses on, I can't see anything. Distorted and unstable self-image or sense of self, impulsive and often dangerous behaviors. You see this a lot, and you know, and they experience regret afterwards, but oftentimes can't apologize because they don't know they don't know how. They don't know whether to say they're sorry to the person or whether they should just shut up, never speak to it again. And oftentimes they'll leave a situation because they've embarrassed themselves, and they'll realize it after they behave that way, or they will stick to their guns. A lot of times they'll say, I was right, I should have done that, and you deserved it, blah blah blah, and then the other person leaves, and that increases their feelings of abandonment. So but they'll do things like have spending sprees, unsafe sex, substance abuse, reckless driving, binge eating. Now, okay, these are some of the things. If this happens to someone when they're in like a manic phase or when they're in a real up phase, that doesn't necessarily mean that they have borderline personality disorder. That can happen with bipolar people, with schizophrenic people, schizoaffective people, narcissists. I mean, everybody can, all different personality disorders, and even people with no diagnosed personality disorder can go on a spending spree and spend way too much money. I've done that with shoes. So, you know, if I can do it, anybody can do it. But that's not necessarily, like I say, that's not a borderline personality disorder symptom per se just by itself. Self-harming behavior. We see this in, I'd say 99% of people who are diagnosed with BPD. They self-harm. You may not see it. They may do it in front of you. I've had patients, you know, pull, you know, keys out of their purse and try to scrape their arms, you know, when they're in pain, and you have to physically stop them. Self-harm is so prevalent, and if you know someone who is hurting themselves, who is cutting, please get them help. You need to call someone right away. Reoccurring thoughts of suicidal behaviors or threats. If they threaten to commit suicide and they're always doing it, take it seriously. Okay, if someone threatens to commit suicide, they're asking for attention. They're asking for help. If they say they're going to kill themselves, call the hospital, call the police, call 911, call their therapist, get them taken in. Because even if they're only threatening and they don't mean to do it, they still need attention. They still need positive attention from a mental health professional, okay? Intense and highly changeable moods, with each episode lasting from a few hours to a few days. They can be high as a kite, happy, yeah, it's awesome, and then immediately angry. But these symptoms, they can move very quickly, or they can be for days. I saw someone who has been diagnosed with borderline personality disorder, and I'm sorry to say they were in a manic state for probably 4 days, doing things that they would never want their children to see. And it was online, and, you know, there wasn't much I can do. I'm an online person watching this, and all I could do is say, please calm down, please stop, and encourage someone to get that person help. But, you know, those states, whether it's a state of grief, you know, or hypomania, you know, psychotic behavior, it can last until something else happens to change it. And it's very scary. And if you have a loved one or a spouse or a child with this disorder, you need to recognize that those behaviors, they can really hurt themselves, and they need to get help immediately. Whether they're crying or whether they're screaming and, you know, ready to tear the walls down, either way, get them help. People with borderline personality disorder have they are very insecure about who loves them, who cares for them, who likes them, and so they don't trust anyone. If you love them and, you know, you say, I love you, you have to say it all the time because they really don't believe it. And then eventually they say, I've had patients say, yeah, my husband tells me he loves me all the time, but I know he doesn't. And I'm like, he wouldn't be with you if he didn't love you. He wouldn't be taking care of you. He wouldn't make sure that he tells you all the time. He wouldn't be faithful and loving if he did not love you. And they have a really difficult time understanding how anyone can be their friend or love them and stay true to them. You know, they think everybody's going to screw them over or disappoint them. They have feelings of dissociation. This is probably one of the defining factors when you're getting a diagnosis is they feel cut off from themselves. They might feel like they're outside of their body. They might feel like they're looking in upon themselves. Especially if they're online, they see the person in the monitor, but they see that person as a separate person from themselves. They don't identify that they are that person. So dissociation, that's common, and it's an important thing to watch out for when you've got a child or a loved one who is going through these symptoms if they talk about, you know, that's not really me, that wasn't me, or I don't feel like I'm me, I don't know who me is, then, you know, please get them help. Now, not everybody with BPD has every symptom. We know this, okay? They could have a few of the symptoms. They could have all of the symptoms. Also, we know that people with borderline personality disorder, if they are left untreated, they will go on and they can develop, you know, severe anxiety. They can develop bipolar behavior, bipolar disorder. They get different illnesses, mental illnesses that go along with BPD. BPD seems to be like the first stage, and then others come along. So as the person grows older, say they're diagnosed when, and the diagnosis usually starts when they're between 18 and 21. That's usually when we see it. If you see them going on and they're not getting treated and they're not getting help, you'll often see anxiety disorders. You'll see all sorts of different mental illnesses that it seems to spring, and it's almost like a vine. It comes from it. So they'll need to be treated with medication for those. But medication doesn't really help BPD. You know, it's all talk and understanding and getting them to understand their behavior in the relation to others. So, you know, it's nothing to dismiss. If you hear someone say, I've been diagnosed with this, take it seriously, okay? Be a little more understanding. And let's go back to triggers. What is a trigger? A trigger can be a thought that the person has, because we know that borderline personality disorder comes not only genetically, but it also comes from the environment that they were raised in, usually with abuse or extreme stress, or you know, lack of parental understanding. A lot of times the kids will have either no parents that pay attention, or their parent will be like, you have to do this and you have to be perfect. It's too much stress on them. So we find that you know, there is an environmental factor growing up, and then later on sometimes drug abuse exacerbates the situation, and you know, it makes it more difficult to treat. So be understanding. And the triggers are often thoughts, and they can be positive or negative thoughts about something that's happened in the past. It could be something like a movie that reminds them of a time that they were hurt or angered, or, you know, something happened bad on the night that they watched the movie. That movie will be a trigger. And the patient with BPD has to understand what their triggers are and avoid them. And if they tell you, you know, these things, A, B, C, D, really bother me and I can't deal with those, and because it's PTSD, and that comes along with borderline personality disorder a lot of the times. We see that a lot. But that's where the triggering comes in. And that's why I hate when people say, oh, I'm triggered, I'm triggered. No, sometimes you're just pissed. People need to quit using the word trigger wrong, okay? A real trigger is something that causes you to delve into a psychotic break, hysterics, anxiety, a physical as well as mental reaction. That's what a trigger does. Okay, it's not just something that makes you mad. Oh, that triggers me when she talks to me like that. No, stop. Quit using words you don't understand. Anyway, okay, so the basis of this, the fact of the matter is borderline personality disorder is really difficult to treat because there's so many levels, and you have to have the patient working with you. You can't just say, here's your cure, and have them go home and be all better. And it's like that with a lot of these, you know, psychological disorders, you know, personality disorders. You can't just take a screwdriver to it and fix it. You know, they have to work with you, and they have to want to get better. And you know, I see people say, oh, I've got BPD and I smoke pot and it makes it all better. No, it doesn't. Pot's not a cure for everything. It helps with some things, but it's not a cure for everything. And especially with borderline personality disorder, because you have to be cognizant of your behaviors and your actions to be able to control them. Okay, that's why if you've got BPD, I hope you avoid alcohol. I hope you avoid any kind of drugs, illegal drugs, you know, from CBD, you know, on down the line. You know, there are some things that you should not be taking or using to treat this, to, you know, self-medicate, because all it does is make it worse. If you have borderline personality disorder, you need to be cognizant of your surroundings and your own behavior. So, and if you want more information, just send me a message. You all know how to get in touch with me. Please like and subscribe down at the bottom if you like these series, and I'll keep doing them. Thank you all for the suggestions. I really appreciate it, and you know, keep your comments coming, keep your suggestions coming, and always remember that I love you, you love you. Now have a good day. Bye. I bet you thought I was done. I thought I was done too, and then I remembered that I forgot to give you all the name and author of a book that I recommend for all patients with BPD, all parents, spouses, anyone that has someone they care about that has borderline personality disorder, and it's called I Hate You, Don't Leave Me. Okay, and I love the title because it's so appropriate. But it's by Gerald J. Kreisman, and you can find it on Amazon. There's the original book, and then there's a workbook. But it's called I Hate You, Don't Leave Me. And I'll have that in the description down below as well. But once again, I love you, you love you. Take care of yourselves. Bye.